Hello again, everyone. Sean Patrick here. First, I want to apologize for the tardiness of this report. I know all of my, 12 and a half viewers have been avidly awaiting this. But I got writing yesterday and just kept writing, and it was a quarter to 12 last night when I realized that, I'm just going to have to wing the last of it and get this on video. Yeah, that didn't work out so well. So I've rested, having some coffee, and I'm going to do this one for last night, and then I'm going to, get to work on another one for today. So, here we go. To start, I want to say something about my last post. When I gave a brief history of my health buggery and my present situation, I was merely putting things into context for those who may be watching that don't know me, to show how seriously I am taking this crisis. It was in no way a plea for help. I have a wonderful family and fantastic circle of friends who always have and continue to take care of me, albeit at a distance now, which I'm sure they prefer. Even though all that personal crap, and some you'll be hearing tonight, really sucks, there are far more needy people than me. Please help. And to further prove that I'm not a complete jerk, I'm going to give out some virtual hugs and kisses. I want to send virtual hugs and kisses to my PR team. These two sassy lasses are doing a great job getting me exposure on the other social media I don't pay any attention to. I got a lot of watches, and they can't all be from my mom, she's dead. I'm not on Facebook or Bitcher, or I haven't looked at my Instagram for months. And with that in mind, please put your comments on the YouTube comment section. I will read them and respond, or make a suggestion of something you think I should talk about. Ask questions, or even try to tell me that I did something wrong, which I didn't. I want to send virtual hugs and kisses to all the musicians and crew for the Bay Strikes Back tour, especially Chuck Billy, who tested positive, but according to sources is feeling much better now, Will Carroll, who was in ICU on a respirator, and Gary and Lisa Holt, who described the testing as very unpleasant, which proves that you don't have to be a cokehead to be a musician. And hey, Chuck, my sister and I bought tickets to your May 11th show in Toronto. That's obviously not happening now, and I've wanted to see Testament play forever. So get better, because when this is all over, you owe us one. And finally to Mrs. Trudeau, who was infected with the COVID virus, but has pulled through. Good job. We're glad that you made it through. And she is now reportedly resting in cottage country with her children. Virtual hugs and kisses for all of you. If you've been watching the CBC coverage of the addresses, which I'm assuming you have, you've probably seen the various reporters and pundits talking before, between, and after the addresses. In today's pregame show, they used a small but interesting clip of Dr. Anthony Fauci from the U.S. National Institute of Health, who seems to be the Wisconsin cheese of American medicine. The clip was a small response to being asked to estimate the number of deaths they'll have in the U.S. He did give an estimate, but more importantly said, quote, "I just don't think that we really need to make a projection when it's such a moving target. Can you take a note of that, all journalists?" But seeing this small bite, I went to find the full interview, assuming that the interviewer had badgered him into it, and I've been focusing only on Canada. Well, what I found on CNN was far more than I expected. I'm not going to go into it too much, but you really should watch it to get a bit of an idea of the present U.S. mentality. Not only did this waste of a suit ask for that number, he also asked the how long question, which is actually kind of interesting in the States because they have such a lack of uniform response and are threatening to ease restrictions. But then he said, and I quote, "The U.S. now has the most officially reported coronavirus cases on the entire globe. Of course, that requires you believe all the countries reporting, including China, but let's just for now assume that the U.S. numbers are largest." Wonder where all that mistrust came from. It's just too fucked up down there, and I think they need to declare John Oliver an essential service. Get back to work, you lazy wanker. And then there was the new or clearer advice on taking a walk. Same things you've heard a million times. If you're showing symptoms, tested positive, or recently returned to this country, hell fucking no. Everyone else, stay the fuck away from each other. And now for Dreamy Justin's address. What? Of course I'm talking about the Prime Minister. Who do you think I'm talking about? Now, why would I be talking about Bieber? Do I look like a teenage girl? Sorry, my imaginary assistant Sandy asking stupid questions. He doesn't even do an address. So the Prime Minister directly addressed kids and unveiled funding for the Kids Help Phone and other child services with the clear expectation of more child abuse, since parents now have far more time and motive to beat them. I know that my brothers and sister have been thinking about what our house would have been like if this happened when we were kids. Well, let me take a moment to speak directly to kids. Hey kiddies, it's really sad that due to this crisis, we can't let you play with your friends in the park to escape your drunk parents fighting over bills. I bet by now you're even wishing they'd reopen the schools. But when you're riding your scooter around outside for much needed fresh air and exercise, stay the fuck away from other people, especially the bloody old ones. Next was more support for seniors. Many are in retirement homes, which are obviously, as is any close quarters living arrangement, an especially vulnerable place. It is extremely difficult for them to stay connected to family in this crisis, which is why Nova Scotia Premier Stephen McNeil is distributing 800 iPads to long-term care homes. And kids, I want to speak to you grandparents now. When this crisis is all over with, can one of you please show me how to use a friggin' iPad? And then Trudeau announced more funding for homeless and domestic abuse shelters. I've lived on the street and worked in a women's shelter, so trust me when I say that this crisis for them is a whole lot of suck icing on a big fat suck cake. I truly hope this funding does some good. Well, those were the main points, and now for the questions. Again, the enforcement of physical distancing, quarantine, and unnecessary travel ban came up. Twice. They've been now asking about having the army come in to do this. Many of us are being smart and taking care of each other by following the rules. I can't imagine a single reason not to, but I've been chatting and Skyping with people in various regions of the country, and I now understand why people are feeling the need for enforcement. Because there are a lot more fucking superheroes out there than I thought. I know people who are permanent residents in different areas of Ontario's cottage country who tell me similar stories. One talked about going to the grocery store and seeing so many people who have seasonal cottages suddenly show up, and their groceries are getting handled by people from various regions, creating huge amounts of transmission risks. Another pointed out that the people leave the city without stocking up, get to his area, then go grocery shopping. On top of the obvious transmission issues, these grocery stores had been stocking based on the permanent population of the area at this time normally. So guess what happens? And then there's my wife Lisa telling me how people are not self-distancing and are all over the streets of Toronto. Being as pro-government as I am right now is very shocking if you know me. But now I have to go further. If the superheroes aren't content to put their tights and capes on at home and pose in the mirror, bring out the military. Another journalist asked Mr. Trudeau if he was concerned at all about the extra pressure put on train and plane staff to do screening. The way I see it, it isn't pressure, it's empowerment. Instead of hurtling through space in a tin can with a bunch of jack-offs coughing and sneezing all over the place as usual, they can actually do something about it. They aren't doctors or nurses. They aren't expected to give tests or stop everyone who might have the virus, and nobody is going to hold them accountable for that level of screening. Just identify and remove people with obvious symptoms. Just do what they can to keep themselves and everyone else as safe as possible during this nigh apocalypse. We shouldn't even have to ask them to do this. There should be no reason. Then there were two questions from the same journal whom I'm pretty sure was partially responsible for making me feel like I should do this in the first place. Their first question was asking what kind of a message is being sent to Canadians about our healthcare system and where we are in the curve when arenas and community centers are being converted into makeshift hospitals in various places across the country. Not only did our government tell us this was going to happen when they started telling us to stay home, they also explained why. Just because we're going through a crisis with a super communicable virus, people aren't going to stop breaking their arms, or get hurt on the construction site, or end up in a situation where they need hospital care but are not viral. The hospital has been set up to be easily sterilized to the level needed to discharge a patient who had something communicable and have another patient in that area quickly. We can treat those non-infected people elsewhere and still have full access to the proper hospital facilities. Also, test sites can be set up easily to keep people who are at this point only worried or showing mild and or similar symptoms out of the emergency system, out of the actual hospitals if they don't need to be there. This all says that our healthcare system is being smart, responsible, and proactive. As for where we are in the curve, your next waste of time question answered that. So then they asked if our healthcare system was ready for the surge being caused by the influx of travelers returning from abroad. First of all, if you're asking about the coming surge, we're still working our way up the curve. And second, this is yet another one of those questions that is impossible to answer. Unless you quantify the surge, we can't tell you if the healthcare system we have at present can handle it. And when our Prime Minister was done doing his political mouth dance, which is all we can expect after a question like that, they yelled at him, "But can it handle the surge?" And that's not all. Then there's the multi-minister's address, which was its usual informative piece. You know, the numbers as usual. And most of the questions were pretty decent, except for how many ventilators will we need? Again, unanswerable. But then the journalist I just railed about showed up. Their first question was actually quite good and was well answered by Dr. Theresa Tam. Then the journalist asked about the surge again and if our healthcare system can handle it. Even though our Prime Minister already answered that as effectively as possible, they felt it necessary to waste another important official's time with the same impossible question. Way to go, genius. Well on your way to becoming a superhero. And doing a great job of turning me into an arch nemesis. So now, let's have some news from abroad. Stop licking Belgian pussy! A house cat in Belgium has won the race to be the first feline to catch COVID-19. Now, before you all panic and start throwing your cats out the door into the faces of unsuspected people walking by, they're pretty certain that it was transmitted from human to cat, not the other way around. And this led me to the discovery that 2 dogs in Hong Kong have also been reported to have contracted the virus, also passed from humans, and one of those dogs has died. So you know all that gross facey stuff you do with your pet that you shouldn't be doing anyway? Knock it off! All right, that's all for now, folks. Hopefully I'll be back later. Got to make a couple changes to things, and hopefully have some more informative, sarcastic fun. All right, so remember, stay the fuck away from each other and wash everything a lot.